Hello, I'm very glad to be among you today. Today, we present the second short lecture of the first webinar of second series of ASCO-GOIS International Webinars and Certificate Game Changing in Global Oncology. The title is about why a lot of further research in radiotherapy is needed. Today we present the first part. Second part will present in the next webinar. I am Ahmed Zawawi, Professor of Clinical Oncology and Nuclear Medicine in South Carolina University, Egypt, Chair of Win-Win Initiative, Chair of Board of Direction of Global Oncology Implementing Science, GOIS, is a part of GoU, and is a link, and founder, President of ICDoc, International Campaign for Research and Training, for International Campaign for Establishment and Development of Oncology Centers, and ICDOC's Expert in Cancer Without Borders. This is a link, and past president of Aortic, African Organization for Research and Training in Cancer. Disclosure from conflicts. I'm sorry to repeat this, but this is needed. It is a non-disclosure of conflicts, none. And I completely follow scientific approaches, works of many scientists, and evidences. I don't take fees for my lecture out of my university or financial support from any. That is means that we are free completely in GOIS to express based on science. I am aligned only to what could be beneficial to millions of cancer patients, as always repeated in GOIS. To be clear, welcome all, and this opportunity to all to express freely but with scientific approaches or references and evidences. Well, GOIS is forum for all. As we stressed always that we follow free flow of ideas, flexibility of thought, smart innovation plus exploration of older and classic ways. The big brainstorming hypothesis here is that we claim that the field of scientific studies of radiotherapy is still in need of many research studies and game changing. What do you think? This invitation to start the discussion now and after is open forum. You can send your feedback and you can contribute, you can publish. Invitation for discussion. This brainstorming is meant as a starting of stimulating points. Its value depends on your discussion, feedback, modification, constructive criticism. No problem to correct us. And additions. We welcome all your feedback before, during, and after the second GOIS, ASCO-GOIS International Webinars. Please feel free to take some of these points to discuss in your institutes and organizations, societies, and even to publish with your outcome as authors. We don't claim any ownership. We are just initiator stimulating. Why more research is needed in radiotherapy and related to sciences? To date, radiotherapy with or without surgery is responsible for most of the cure in cancer. All cancer drug therapy is responsible only of 11 to 12% of cure. Maybe in some studies now it's slightly more, but not much, of cure in cancer, and more in the upcoming years. The remaining is attributed to surgery and radiotherapy. 50 to 60% of cancer patients will need radiotherapy along the course of their disease. There is growing more indication for radiotherapy in the upcoming years, not as some may think. There is growing more indication of radiotherapy in combination with new technology like targeted drug delivery, nanotechnology, and particularly immunotherapy. The future is still there. As we know, despite all the efforts, organization, society conference, summit declaration, etc., and talks and thousands of publications, there has been along the last four decades or 3 decades, although it needs to waste time to dispute about that the gap between the needs and available radiation oncology service is widened in the last two decades. If the stakeholder continue with the same previous ways, the same approaches, the same conferences, the same World Day of something, the situation will only worsen. There is a burning need for a lot of focused scientific approaches on how to increase affordability of better value cancer care via science, with consideration of the interest of all stakeholders in the real world. An example is our first series of ASCO-GOIS international webinars focused on systemic cancer therapy. Here is the link. You'll find the free access to the 5 webinars with very interesting examples and public and reference and everything. Our second series is focused on radiotherapy, molecular radiotherapy combined with immunotherapy. This series. Radiation therapy is a core modality of cancer treatment. However, concerns have been expressed regarding its underutilization and its lack of prioritization as a research domain compared to other treatment modalities, despite its rapid technical evolution. As you see this in conference and many things and many festivals of cancer, etc. Money talks. A total of 62,550 62,550 radiation therapy research articles from 127 countries published in 2,531 international journals were analyzed. The United States were responsible for 32%, Japan 8%, and Germany 7%. But what is I would like to stress on here that trial-related radiotherapy publication represented only 5.15% of the total output. You look for other trials and other domain and something, you see the difference. Greater support for radiation therapy research, including international collaboration in low and middle income countries. This could provide the requisite knowledge to guide future radiation therapy research program. And a win for all. Here is some reference, and the first one you find a full text-free for all. And this approaching oncology, our book. We continue in the second webinar, but we give you an idea, and if you like that we send for you the full text of the second webinar 3 weeks before the webinar. The second webinar will be 26th November at 3 to 5 p.m. This time will be in Greenwich time. Just send to us. Welcome. There is a need for many studies that include clinical radiation oncology, biology, radiogenomics, single nucleotide polymorphism, variation in responses and toxicity, physics and engineering. Example of exciting points that will be presented in next webinar. It is not exhaustive list, but example. You imagine that this is just examples. Brainstorming on different way of delivering radiotherapy, fractionation, our preliminary suggestion for definition of subcategories for model type of fractionation. I suggested subcategories. Suggestion for subcategories, and it is for discussion for model type of fractionation for your discussion and crystallization. Please feel free. Schedule equal doses per fraction, or to be not equal. It should be the same every day. The time of decision of session of radiotherapy, chronology and chronoradiobiology. and time and effect of time of administration of concomitant administration of concomitant medicine. There are some examples already for this, but it is still open for many research for other drugs. Flash therapy. How do those single dose perfraction and fractionation schedule can influence the abscopal effect and immune responses? Smart radiotherapy biomaterials for combining radiotherapy and immunotherapy. I have a question. Is the term 2D radiotherapy, two-dimensional radiotherapy, right? What presents a starting point of collective brainstorming? Its purpose is not to present final answers. We don't present final answer. We present some answer, but we leave other for you. It is many things to be raised by you, but to raise important question about direction of radiotherapy research and to spark collaboration. Then the big issue is along the series that we are focused on. The need for implementation studies and innovations that reduce cost of cancer care without compromising outcome. How to increase affordability of better value cancer care through science in the real world, not by talks, not by planning, not by not realized planning along the last 3 decades. This is the main issue in our series, like the series of previous series, and here is in our book 45 chapters and other references. Is our claim, comes the important question, is our claim that this field of research and studies in radiotherapy and related fields and sciences is still virgin? Is it true? Is it true? What do you think? This brainstorming will be of value only with your discussion, feedback, suggestion, constructive criticism, addition and modification, follow up. It's open. It's not webinar and goodbye. It is follow up. Thank you all on behalf of the leader of and distinguished faculty of GOIS, GOU. And please have this message always with you and send to your colleague on your network. Implementing science to make cancer care affordable, a message of love for all humans through science, not by talks, not by festivals and etc. of world days of by through science. Thank you all, and going forward in fruitful cooperation. This endeavor is yours, and it will succeed only of your contribution now in the future. It is between your hands. Thank you all. Bye-bye.